Today I'm speaking with Rebecca Rains, who is a registered nurse, and she has recently started her own business where she's a geriatric care manager. And I'm just going to let her explain a little bit about what that is because, you know, it seems like it's such a big, wide open field, and I don't really understand everything you do. So could you tell us what a geriatric care manager is?
I absolutely can. Geriatric care management has been around for several years, but many people have not heard of it until recently when the sandwich generation, the baby boomers, are now coming about and having concerns about either care for themselves in the future or care for their aging parents. We are a geriatric care manager as a group of human and health experts, such as nurses, counselors, geriatrologists, licensed social workers, and we look at the overall care and welfare of the human themselves, of the aging adult, of those with disabilities as well. We can look at the psychosocial issues, the medical issues, any type of financial, legal status issues. We look at the overall health and human well-being.
Wow, so you kind of just have a broad range of things you need to know about.
Absolutely.
I mean, I've been working in long-term care for about 10 years in the field of occupational therapy, but I feel like that's all I know about. You know, when somebody's going home, I've heard bits and pieces, oh, here, this is available, that's available, but you know, if I was looking for somebody, you know, for my mom or, you know, one of my loved ones, I would really need to hire somebody like you just because it seems so overwhelming. There's just so much to know. Are you a member of any kind of an organization?
Yes, I belong to the National Association of Professional Geriatric Care Managers, and that is a site that is, we have a standard group of ethics that we must follow for practice, and we do have a website, so you can look up in your local area as well. We have them all over the United States.
Okay, can you give that web
Sure,
address?
it's caremanager.org, www.caremanager.org, and then you can put in your zip code, and that will pull up a list of geriatric care managers in your location.
That's great. When you first got your training as a nurse, did you know this was something you were going to go into, or did you practice in other fields first?
Actually, I practice in other fields. When you graduate from nursing school, the first thing is go into med-surg. Nobody wants to go into medical surgical, but it was the best thing that I ever did. I got a lot of my basis for nursing out of this area, and then I progressed up to, I did neonatal intensive care. I have done pediatrics ICU. One nice thing about nursing, you have a very wide range of areas that you can specialize in. But I knew that I would always come back to the aging adult, the ones with disabilities, and the overall need for help. Chronic illness is also another area right now that my business expands to, not just the older adults.
Okay.
We also do special needs, and we also do chronic illnesses as well. So this is anyone from the infants all the way up to the aging adult.
Okay. Well, how would somebody know that they need you or somebody like you?
Well, that's a very good question. Most of the time it takes quite a while for someone, especially the caregiver, who is usually a woman in her 40s and 50s, that is caring for a family member, to figure out that it can be very overwhelming. Most people are trying to, that's why they call it the sandwich generation. They're trying to juggle the family, they're trying to juggle their own career, they're trying to juggle the care of a family member, especially a parent, and when it gets just too overwhelming, that's when it looks like it's time. One of the big flags that it's time. Another one is you may have a family that is not, I don't want to say cooperating with each other, but they're not seeing the same plan of care for their loved one. So we can step in and do some counseling type services to them to try to help them figure out a plan that works for the whole group. If you have someone who may be memory issues, dementia, we can also help with educating families on a lot of the disease processes that are going on as well.
That's great. So I'm sure a big question in everybody's mind is, well, how am I going to pay for a service like this?
Well, I want to start off by an unfortunate thing, but the unfortunate thing at this point in time, Medicare and Medicaid do not recognize the individual geriatric care manager or care manager services. So most of it is fee-for-service, or it's an out-of-pocket expense. Now, there are some long-term care insurance policies that do cover our services, and they're allotting some of their members several $1,000s a year out of their benefits to cover our care coordination services.
It seems kind of a shame that Medicare doesn't cover it, because it seems to me that it would be a very cost-effective, in the long run, way to manage services.
Oh, it absolutely would be. That's one thing that I think as a group in our organization has said, that we're striving for education for these insurance companies, for the Medicare and Medicaid organizations, because this care coordination could save them time and money over and over.
Okay, so just so I'm sure that we all understand, give me an example of, let's say, a lady who's 75 years old, maybe her family doesn't even live in the area. What are some of the things that you could go in there and provide for her?
Well, that's a good point, and that is actually one other area that we could help assist people. There are many, many people that have educated themselves and moved away from town and away from their family members. So we consider them long-distance caregivers. They can't be here all the time. They might come in during holiday times. They might come in every so many months. There's a lot of expense in being a long-time caregiver. They say up to $8,000 a year some people can spend on the traveling, or even the time. The time away from their work can be up to almost 20 hours a month. What we can do is, if we are hired to oversight and monitor their family members' care, we can go in, we can set up depending upon their needs. Do we need to see them on a daily basis? Do we need to go in and find a caregiver for them? If we do, we can oversee and monitor the actual caregivers' duties themselves.
Okay.
And then we can take their loved one to the doctor's appointment. We can also report back to that family member any concerns, or just even that they're doing fine.
Okay, so a lot of these things, like taking them to the doctor or overseeing, this is not always personally just you doing it. I mean, you're the one it's like you've got the contacts. Is that how that is?
A lot of it is I am actually doing.
Really?
I'm actually
Okay.
doing the oversight and monitoring of this.
Okay.
When I start looking outside of my services is to provide non-medical caregiving.
Okay.
But we can do as little or as much as that you want us to do to help ease your overwhelmingness and to help assist in obtaining the smoothest care coordination for your family member. If you want us to go out and find that caregiver, we'll interview and find that caregiver. If you want us just to come in and make sure that they're doing everything they're supposed to be doing, we can be that contact person for your private caregiver individual, because they don't have a company that they can fall back on. So we can be that question and answer person. I have a client right now that we do that with. We have a caregiver that's in there, and they have no company that they work for, so they come to me as a source and a resource for information and education.
Okay.
And then I report back to the family. We can go into the nursing homes and make sure that their loved one everything is being done for them.
Adequately cared for.
Yes, absolutely, adequately cared for. And to make sure that everything is being done. It's too hard for when you live out of town to make sure that we're your eyes and ears, and that's about the easiest way I can explain that we are the adopted daughter, as some people have claimed me to be. This is Mom, now your new adopted daughter, you know, so we...
Okay, well, and I guess that leads me into another question. You said that you can do as much or as little as the person needs. So how do you bill? Like, do you have a set fee, or can a person kind of pick off a menu, so to speak?
You can do both. You can pick off a menu. You can pick off when you call and ask us for assistance. We are not asking for an obligation of a set amount of hours, a set amount of time. What we're looking for is whatever we can help you with. We can do it on an hourly fee, or we can also do it on a package. If you're looking for monitoring at a set amount of time, say 2 times a month, we can set a rate for that. Okay. So we are mostly an hourly rate.
Okay.
When I work for some of the other professionals out there, like possibly elder law attorneys, there are sometimes we can do package rates as well.
Okay. Well, if somebody wants to get in touch with you, what's the best way for them to do that?
Well, they can either call my phone number, which is 330-962-8494, or they can contact me on my website, transitionalcaremanagement.com.
Okay. Is there anything that I forgot to ask? Anything that you feel is important to add?
Well, I just want to let everybody know that we do have free consultations, so if you'd like to give us a call, we can find out whether or not this is something that could work for you.
Okay.
All right.
Thank you so much, Ruth.
Thank you.